Good morning. Today we are going to be seeing about squamous papilloma. So what is squamous papilloma? Squamous papilloma is a benign HPV-induced lesion characterized by the proliferation of stratified squamous epithelium resulting in a papillary or verruciform mass. So basically it is a benign epithelial pathology that is caused by a human papilloma virus infection. This in turn results in the proliferation of your stratified squamous epithelium, giving rise to a cauliflower-like appearance or a verruciform mass. So what actually causes this lesion? So what is the etiology? Squamous papilloma is caused by a human papilloma virus type 6 and type 11. Human papilloma viruses are double-stranded DNA viruses belonging to the Papilloma viridae family. Human papilloma viruses exhibit a special affinity or tropism for squamous epithelium and may infect your skin or your mucosa. Hence, they are called as epitheliotrophic viruses. More than 130 types of these viruses have been identified. These HPV viruses can be broadly classified into high-risk types and a low-risk type. High-risk types of HPVs are associated with the development of malignancies, while low-risk types are associated with benign pathologies like your squamous papillomas. Squamous papilloma is caused by your HPV type 6 and type 11, which are low-risk type of HPVs. So how does a person actually acquire this virus? Human papilloma viruses can be acquired by both sexual and non-sexual person-to-person contact, by saliva, by sharing of contaminated objects, and by auto-inoculation. So once the virus is acquired, the incubation period is usually between 3 weeks to 2 years. Coming to the pathogenesis, your human papilloma virus goes and infects your basal cells of the epithelium and interferes with the cell cycle regulation and uses the host machinery to synthesize proteins needed for the viral replication. When the basal cell divides, one daughter cell remains in the basal layer to maintain the viral reservoir and the other daughter cell migrates through the layers. The mature virions are shed along with the epithelial cells. By dysregulating the cell cycle, the human papilloma virus is able to cause proliferation of the squamous epithelial cells. So this is the etiopathogenesis of the squamous papillomas. So moving on to the clinical features. So squamous papilloma can occur at any age, but it is usually diagnosed in persons between 30 to 50 years of age. There is usually no sex predilection for the lesion, however, a slight male predominance has been noted. So coming to the site of predilection, your squamous papillomas are usually seen in the palate, the tongue, and the lips, but any oral site can be affected. It is the most common lesion occurring in the soft palate. On clinical examination, on inspection, squamous papillomas usually appear as a solitary exophytic nodule with numerous finger-like projections that give it a cauliflower or a wart-like appearance. These projections may be blunt or they may be pointed. The lesion can vary in color from white, red to normal color depending upon the degree of keratinization. The lesion usually ranges in size from about 0.5 centimeters to 3 centimeters in greatest dimension. On palpation, the lesion is usually soft and painless and may show numerous surface projections. Coming to the histopathology, so on histopathological examinations, numerous key features can be noted. So squamous papillomas are characterized by proliferation of keratinized stratified squamous epithelium arranged in finger-like projections with a thin fibrovascular core. So your squamous epithelium is going to be showing proliferation and they may be arranged in numerous finger-like projections with a thin fibrovascular core. So if you look at this histopathological section, we can actually note that the epithelium shows proliferation and it has been thrown into numerous finger-like projections with a thin fibrovascular core. So clinically, the lesions that appear white have a thickened keratin layer, while those that appear red have less amount of keratin in the superficial surface. The connective tissue shows inflammation, which may consist of your chronic inflammatory cells. Another special feature that is usually noted in these type of lesion is the presence of your coilocytes. So what are these coilocytes? Poilocytes are basically virus-altered epithelial cells. So these cells on histopathological examination appear larger than your normal spinous cells, and they have a crenated pycnotic nuclei surrounded by a clear halo. These cells are usually noted in the superficial spinous layers. Poilocytes are not only seen in your squamous papillomas, but they are also seen in other HPV-associated lesions, including your verruca vulgaris. So coming to the treatment. So how do you actually treat the lesion? So squamous papillomas can be treated by conservative surgical excision. The entire lesion can be excised by using your scalpel, and this serves as the final treatment for the lesion. Recurrence usually doesn't occur.